Irritable bowel syndrome with constipation, or IBS-C, is a disorder of gut-brain interaction with a multifactorial pathophysiology that is characterized by both constipation and abdominal symptoms, including pain and bloating. IBSRELA provides a different mechanism of action in a different class to treat IBS-C. IBSRELA is not a secretagogue. IBSRELA is a first-in-class, minimally absorbed, locally acting inhibitor of the sodium hydrogen exchanger 3, or NHE3. NHE3 is highly expressed on the apical surface of the small intestine and colon and is primarily responsible for the absorption of dietary sodium. By inhibiting NHE3, IBSRELA addresses constipation and abdominal pain of IBS-C in 3 ways. First, IBSRELA blocks dietary sodium absorption. In clinical studies of healthy volunteers, IBSRELA has been shown to block the absorption of up to 3 grams of dietary salt with no impact on serum sodium levels. By reducing dietary sodium absorption, luminal water content is retained, accelerating intestinal transit time and resulting in a softer stool consistency to address constipation. Second, by inhibiting NHE3, IBSRELA decreases intestinal permeability, resulting in a reduction in abdominal pain. And third, by inhibiting NHE3, IBSRELA decreases visceral hypersensitivity, which also reduces abdominal pain. IBSRELA provides a different mechanism of action in a different class to treat the multifactorial pathophysiology of IBS-C. IBSRELA, tenapanor, important safety information and indication. Indication: IBSRELA tenapanor is indicated for the treatment of irritable bowel syndrome with constipation, IBS-C in adults. Important safety information. Warning: risk of serious dehydration in pediatric patients. IBSRELA is contraindicated in patients less than 6 years of age. In nonclinical studies in young juvenile rats, administration of tenapanor caused deaths presumed to be due to dehydration. Avoid use of IBSRELA in patients 6 years to less than 12 years of age. The safety and effectiveness of IBSRELA have not been established in patients less than 18 years of age. Contraindications: IBSRELA is contraindicated in patients less than 6 years of age due to the risk of serious dehydration. IBSRELA is contraindicated in patients with known or suspected mechanical gastrointestinal obstruction. Warnings and precautions. Risk of serious dehydration in pediatric patients. IBSRELA is contraindicated in patients below 6 years of age. The safety and effectiveness of IBSRELA in patients less than 18 years of age have not been established. In young juvenile rats, less than 1 week old, approximate human age equivalent of less than 2 years of age, decreased body weight and deaths occurred, presumed to be due to dehydration following oral administration of tenapanor. There are no data available in older juvenile rats, human age equivalent 2 years to less than 12 years. Avoid the use of IBSRELA in patients 6 years to less than 12 years of age. Although there are no data in older juvenile rats, given the deaths in younger rats and the lack of clinical safety and efficacy data in pediatric patients, avoid the use of IBSRELA in patients 6 years to less than 12 years of age. Diarrhea. Diarrhea was the most common adverse reaction in 2 randomized, double-blind, placebo-controlled trials of IBS-C. Severe diarrhea was reported in 2.5% of IBSRELA-treated patients. If severe diarrhea occurs, suspend dosing and rehydrate patient. Most common adverse reactions. The most common adverse reactions in IBSRELA-treated patients, incidence greater than or equal to 2%, and greater than placebo, were diarrhea 16% versus 4% placebo, abdominal distension 3% versus less than 1%, flatulence 3% versus 1%, and dizziness 2% versus less than 1%. For additional safety information, please see full prescribing information, including boxed warning, at ibsrela.com/PI.